A Temple research team has been awarded a multi-million-dollar grant to study the effects of HIV in context of the opioid crisis. Temple Update's Connell Smith joins us live from the Health Sciences campus. Connell?
Good morning, Aaliyah and Jane. Now, Temple researchers over the summer successfully eliminated the HIV virus in mice that they were testing. Now, a different research team aims to learn about neuroinflammation following HIV infection in the opioid crisis.
One of the research team's goals is to learn about the overproduction of inflammatory molecules, which can lead to diminished effectiveness of opioids. Per the National Institute of Health, which is funding the over $3 million grant, opioid abuse is a major contributor to the AIDS epidemic. Drs. Persitsky and Rogers say that when an individual is affected with HIV, their opioid receptors become desensitized, or in other words, the individual becomes more susceptible to pain, which can lead to opioid abuse. In July, researchers from Temple and the University of Nebraska successfully eliminated the HIV virus in the genomes of about 1/3 of the mice they tested. The NIH says that nearly 1/4 of AIDS cases stem from drug usage from a hypodermic needle.
Now, Philadelphia has one of the highest rates of drug overdoses among the nation's largest cities. In 2018, there was 1,116 overdose deaths in Philadelphia. 84% of them were from opioids. Now, earlier, I spoke to Dr. Persitsky to just understand how important this research is for Philadelphia in the fight against HIV and opioids.
Know that opioid addiction leads to a higher level of HIV infection as well as impaired immune responses and heightened inflammation, which could lead to this vicious cycle. More inflammation, more drug addiction.
Now, Dr. Persitsky says that he has high hopes for good outcomes in his research over the 5 years that they will be doing this study. Now, I'll be updating you more on this story as I follow it throughout.